Breast cancer rehabilitation. This week let's talk about axillary cording. If you have a pulling in the arm after surgery, and it can be either, you can look at it in the mirror and it looks like thin cords or a number of cords, or it could be a thickness, then that is axillary cording or axillary webbing, or in Australia we just call it cording. So axillary cording happens after breast cancer surgery, and it feels like a real sting and a real pull in the underarm or down the arm. And the pull or the sting actually makes you feel like you can't reach the full distance that you want to reach. So the pain limits full movement. And what happens is that with the healing from the surgery, the scar tissue that forms in the normal healing mechanism must attach onto some of the tissue that goes down the arm. Now, the tissue we know is actually the lymphatic vessels, and they're the only tissue that extends from the breast down into the arm. So it's not a muscular tendon, it's not a muscle, it is the lymphatic vessels. And the lymphatic vessels are surrounded by a very fine mesh called fascia. And I think what happens is that the fascia gets a little bit attached to the scar. And so as the wound heals and the scar tissue forms, then it becomes a tighter grab onto the fascia, so that the problem is at the scar tissue, but it feels like it's a problem in the arm. And so often women come and they say, I've got an arm problem. Yes, it is. It does interfere with reach, but it really comes from the scar tissue in the breast. Now, why is this important to know what it is and where it is? And it's important because then we can be better at working out what treatments are needed. So women are told to stretch. And so that offers a form of stretch at the tissue that's tight. Now, if this is not enough, and so it doesn't give you relief, then more treatment may be required. And so some of the treatment options here are low-level laser, and that's low-level laser at the scar tissue at the breast, kinesio tape. And so if I use kinesio tape for this, I run it from the site of the scar tissue up into the arm and then follow the lymphatic vessels, so follow the cording down the arm. And the other treatment is to use myofascial treatments. So that's myofascial treatment at the scar tissue. So at the scar tissue that is nabbing onto the lymphatic vessels. So there's many different treatments that you can use. So there's lots of impacts on the body with the chemo and the radiotherapy and the surgery. And so if we know what's happening to our body, then we can work out what can be done to help move it into restoring. So if you found this information helpful, then subscribe so that you can find me again and listen to any new videos that we put out. If you've got a topic that you'd like us to cover, then leave a comment. And together we can really nut out rehabilitation after breast cancer.